Hello everyone, welcome to today's update. It is the 31st of March 2022. Today I just want us to look at the general situation in Africa as per today, and then in East Africa I want us to briefly look at Uganda, Kenya and Rwanda. So I'm going to also respond to the comments that I got in a previous video when I talked about the role of masks, and then when I talked about the vaccines. There are some people who didn't get me well, so I want to clarify something. But for now, allow me to first go through the statistics for Africa and then these three countries. Africa has confirmed a total of over 11.5 million cases. That is a cumulative number, and it has also recorded over 10.7 million recoveries. That accounts for over 98% of people who got infected. So that means about 90, actually more than 98% of all people who were infected recovered in Africa. And then when you look at the number of deaths, as per today, Africa has confirmed a cumulative number of 251,000 deaths. I've not yet gotten access to the vaccination situation in Africa, but I have some information for some few African countries, most especially for East Africa, where I'm reporting from. Uganda today confirmed a total of 13 new cases, which accounts for 0.4%, and we have only 2 active cases. Only 2 people are admitted. The rest of the cases are asymptomatic and they don't need hospital admission. When you look at Kenya, today they confirmed a total of 7 new cases, and they have a positivity rate of 0.2%. The 7 new cases were out of a sample size of 4,166 cases. Uh, both these two countries today, they have not reported any death. When you look at Rwanda today reported a total of 4 new cases, and they were all asymptomatic cases. In Rwanda, as I talk, they have no one admitted in the hospital. In the past 7 days, Rwanda have only reported 25 cases, which accounts for 0.04 positivity rate. So when you look at these figures, you really see that East Africa, the situation is really not bad, despite of the fact that the economy has been fully opened. People no longer follow the precautions that were put out there because now people mix freely. Like the situation has returned to normal according to my observation of the way things are happening in Uganda. So responding on the questions that I was asked about vaccination and the mask, of course, a mask is very important and people can put it on when they have different health related maybe problems. And I have no problem when someone puts on a mask. I'm not actually offended. But as I said, I was interacting with one of the government officials who said that he wanted the Baba to put on a mask because he feared that the Baba would spread Omicron to him, which I say that it was not having much sense because basing on even the studies that have been carried out, almost everyone has been exposed to Omicron. So it will not help a lot. Even the person who was talking, I believe, he could have been exposed to Omicron variant already by now. So that was the reason. Otherwise, when we talk about vaccination, I'm not against vaccination, because we know what vaccines have done in the past. They have done a tremendous work in stopping otherwise deadly diseases like polio in Uganda, and even during the Delta wave. I remember very well, I was one of the people who was advocating for vaccination on this channel. So I could not say that the vaccinations, they are not helpful or they are not important. But when Omicron came in, we all saw the work it did. We saw the results it yielded. We've been vaccinating people in the past when Delta variant was there, but the numbers were still up. But when Omicron came in, we saw a tremendous improvement. We saw numbers of cases being reported decreasing, not only in Uganda, but in other East African countries. And also, we saw this when the economy has been fully opened. That's why I talk like that, because I'm thankful that God gave us Omicron, because it gave protection to all people. Not that every person was going to be able to get the vaccine. During the Delta wave, uh, Africa was struggling to get vaccines because vaccines were really on high demand, and African countries could not afford. And that is what we spent here most of the time talking about, the need for vaccine equity, like equal distribution of vaccines. And there is a famous statement that Dr. John used to make, which says that no one is safe until we are all safe. So we wanted to see that the whole world is vaccinated. We wanted to see that all people have access to vaccines. But then Omicron came as a game changer. So it has changed the way things work. And if we reported those days that Africa should prepare the worst, for the worst, why not to report now that Omicron is doing a tremendous work here? So it will not be wise for us only to report one side of the story. At first, we say that Africa should prepare for the worst, depending on what was happening, depending on how virulent Delta variant was, and we saw that it killed people. But when Omicron has come, I think it is important also to report the benefits or the advantages of this variant that came in. It affected very many people, but it has yielded a lot of results. So I think we should thank God for that. And even people who report, maybe WHO and other organizations, they should also talk about the advantages of Omicron variant, most especially in Africa and East Africa. Otherwise, Uganda has still a lot of health related problems. As I said, over 42 children die of malaria every day, and 2% of women die due to pregnancy related causes in Uganda. And in the whole country, malaria accounts for around 17% of the total deaths. So that is a very huge number. We still have a lot of people dying daily. So I just want that very effort that we put in COVID-19, making sure that we inform people about the numbers of people dying daily. I would wish to see that even these other diseases, we make people know about them such that we can fight together, just like we've been fighting together COVID-19. I love you all. See you in the next video. Bye-bye.